So dear friends, first I will explain you all the movements like flexion of hip, extension of hip, abduction of hip, adduction of hip, internal rotation of the hip and the external rotation of the hip. There are total 6 movements happening in the hip joint. हमारे hip joint में कुल 6 movement होती है. The joint of 3-degree freedom. 3-degree freedom is flexion, extension, adduction, abduction, internal rotation and the external rotation. This is the flexion. The flexion means when we are reducing this angle. Extension, this is the extension. So flexion and extension together is the one movement, or we can do in the standing position. Flexion and extension. This is the movement number 1. The movement number 2, abduction, A, B. This is the abduction. I am taking my leg away. This is the abduction. And bringing leg nearer, that is adduction. Okay. So abduction means taking away, and adduction means ADD, bringing it back. So this is the movement number 2. The third movement, external rotation and internal rotation. Look at once again, external rotation and internal rotation. That's why this is movement number 3, external rotation and internal rotation. So all 3 movements together are called. So that's why we are telling the hip joint is the joint having 3-degree of freedom. 3 डिग्री की फ्रीडम है इसमें. So quickly I will tell you about the muscles as we discussed earlier also. So first I will tell you the muscle of flexion. So there are 6 movements we can see: flexion, extension, abduction, adduction, internal and the external rotation, flexion. So mainly we can see the flexion is iliopsoas muscle. Iliopsoas, as we discussed earlier. The flexion of the hip is mainly done by iliopsoas. So we have to remember our main muscle, that is iliopsoas. So look at in this image. So this is the flexion movement of the hip joint. So there are group of the muscle are doing this. When this movement is happening, we can see the movement of the hip joint. The main muscle is ilio and iliopsoas. These 2 muscles. One muscle coming from the lumbar area, one muscle coming from the iliac area. So this muscle is the psoas major muscle, and this is iliacus. Both together are called iliopsoas. This is the main flexor, main hip flexor, chief hip flexor. There are other muscle also, but this is the main muscle. Other muscle also we can see, like the rectus femoris. Other muscle also doing this movement, like the sartorius, tensor fascia lata, pectineus, and adductor. Longest word, just you have to remember one muscle or maximum two muscle. One is iliopsoas, second rectus femoral. That's enough. They are the wonderful hip flexure. Two muscles, you remember, that is enough. Iliopsoas and rectus femoris. So quickly we will do the movement of this, then we'll see the extension muscle. Then we'll do the movement of extension muscle, then we'll do one by one all. So let's start. We'll do the few movements of this muscle. So lie down in the supine, everyone. Start now. We'll starting from the right leg. We will doing the 10 movements by using the iliopsoas. One, my iliopsoas pulling two, also the rectus femoris. Three, iliopsoas. Four, rectus femoris. Five, iliopsoas. Six, rectus femoris. Seven, iliopsoas. Eight, rectus femoris. Nine, iliopsoas, and rectus femoris. 10. Two muscles are enough. Now doing from the other leg, 10 pound. One, two, three, four, five, six, seven, iliopsoas and rectus femoris. Eight, iliopsoas and rectus femoris. Nine, iliopsoas and rectus femoris. 10, iliopsoas and rectus femoris. So this was the muscle of extension, flexion. Now we'll do alternate movement. Start now. One, one, two, two, three, three, four, four, five, five, six, six, seven, seven, eight, eight, nine, nine, 10, 10. Relax. Now we'll do very simple movement. Folding your both leg from the knee. Now bring your both leg up. Just hold this, that's it. Now what we have to do? Just we have to pull the ceiling by our toes, like I am pulling the ceiling by the toe. One, two, do 10 times. Three, four, five, six, seven, eight, nine, 10. Relax. Relax. So this was the hip flexion. Let's move to the next muscle. That is hip extension muscle. Those who has not completed, they can still continue to do. Till I am moving to the next muscle. That is hip extensor. So what is the meaning of hip extension? Let's see this image. Now I am bringing my leg to the back side. see. So when we are doing this movement, this is called hip extension. We can see this movement is happening on the hip joint. So it is called hip extension. Not only two muscles we have to remember, that's it. Number one, gluteus. And number two, the group of this hamstring muscle. Hamstring muscle is the group of three muscles. Only two muscles we have to remember. So number one, gluteus. They are doing extension. Gluteus maximus. Remember one thing, gluteus maximus, because the gluteus is having three muscles. And this is hamstring muscle. This is the gluteus maximus muscle. The hamstring muscle is the group of three muscles that is called semimembranosus, semitendinosus, semitendinosus, and biceps femoris. Three muscles together are called hamstring muscles. So these three muscles are hamstring, and this is the gluteus maximus who is doing extension. जो extension का काम करती हैं. So look at here. So this is the gluteus maximus. Remember, we are three muscle of the gluteus, so we have to tell maximus. Then this is the biceps femoris. This is semitendinosus, and this is the semimembranosus. Now let's do the movement of extension. Let's start now. We can also do in the standing position. So let's do in the standing position. Holding the wall or some object. Now start. 1, 2, 10 times. 3, 4, 5, gluteus maximus. 6, hamstring. 7, 8, 9, 10. When I am doing this movement, this muscle is doing contraction. But there is a stretching effect coming on these muscles, the flexor muscle. Suppose I do this movement. I can feel these muscles are contracting, gluteus maximus are contracting, hamstring are contracting, पीछे की muscle contract हो रही है, लेकिन आगे की muscle खींची जा रही है. These muscles are getting stretched, like sauce major on the rectus femoris are stretched. अभी हमने बात की थी sauce major and rectus femoris are stretched. So let's do from the other leg. Gluteus maximus, hamstring. Gluteus maximus, hamstring. Gluteus maximus, hamstring. Gluteus maximus, hamstring are contracting. Gluteus maximus and hamstring are contracting, and the front muscle are stretching. The front muscle are stretching. Okay, let's do once again in the lying down. लेट कर भी कर सकते. Let's start doing from the right leg. 1, 2, Front muscle are stretching, psoas major, rectus femoris, who are the front muscle are stretching. 3, do 10 times. 4, 5, 6, 7, 8, 9, 10. Doing from the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this was the extension. Now we can also do Salavasana. So keeping the fist under the groin area, lifting both the leg together. Hold for a while. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax for a while and we'll do once again after a few seconds. Inhale and lift your leg and head up. Do the more and more stretching. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Holding both the leg together, doing Dhanurasana and wonderful extension of the hip. Inhale and lifting both the leg up. Head up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Relax. So this was the extension of hip. Now we'll moving to the next. That is called now 1 degree movement completed. Now we'll be looking the abduction. Abduction means taking the hip away. So look at here. When we are taking the leg away, this is called abduction. AB, abduction. Now we can see the involved muscle here. So from the side we can see this is the tensor fascial lata, TFL. Who is doing this movement? On the back side we see now this is the gluteus medius and minimus. This is the minimus. If I remove the medius, we'll be able to see minimus. This is the inner muscle, that is the gluteus minimus. So there are 3 muscles are doing this movement. What are the 3 muscles who are bringing your leg away? So remember the name of these 3 muscles. Gluteus medius, very important muscle. Gluteus medius. If you remove the gluteus medius, then you'll find gluteus minimus. And TFL means tensor, fascia, lata. So they are the muscle of hip extension. So let's do this movement. Now we'll doing the hip extension. We have to do this movement. First we'll doing in the standing position, then we'll be doing in the lying down position. So we ready for this movement now. Okay. So look at here. So you can, if you want, you can take the support of some object. Like I'm just taking the support of this. Let's start. Bringing the leg away. 1, 2, 3, 10 times. 4, gluteus medius, gluteus minimus, tensor fascia lata, gluteus medius, gluteus minimus, tensor fascia lata. Doing from the other side. Start. 1, 2, 3, gluteus medius, gluteus minimus, tensor fascia lata. Keep on doing. Complete your 10 round. You can keep the hand here and you can feel the movement. How the muscle is shortening. Now we can lie down in the supine, then on the side. Okay, just lie down comfortably. After a few seconds, I will start doing this movement once again. Hip abduction. Start. 1, 2, 3, 4. Gluteus medius, gluteus minimus, tensor fascia lata. Keep on doing. Now we'll be doing from the other side. Start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wonderful. You have done. So now we are moving to the next movement. We have done the hip abduction. So this was the movement of hip abduction. Now we are moving to the movement number next. That is called hip adduction. Now we will be adding. Now we are bringing the leg toward the other leg. So we can see we are trying to bring the leg towards inner side. That is called hip adduction. And these all are muscle who is bringing back, they are called adductor muscle. We can see here. We can see here. These all are adductor magnus, adductor longus. These all are adductor group of muscle. Adductor brevis. So we are telling in the short, okay, adductor brevis, adductor longus, adductor magnus. So this is adductor group of muscle. So who is doing adduction? They are adductor group of muscle. So like adductor, longus, adductor magnus, adductor brevis. These are the three muscle, all the three muscle attaching with the pubic bone near the genitals. So whenever anyone is having any genital problems, these three muscles are involved. जब भी genital problem होती है तो तीन मसल थोड़ी सी stiff contract या spasm में मिल सकती हैं. Few other muscle also we can see like we can see pectineus and the gracilis. Okay, but you remember other muscle, that's enough. You remember just adductor group of muscle like adductor longus, adductor brevis, and adductor magnus. Adductor group of muscle doing adduction. जो हमारी adductor group of muscle होती है वो adduction करती हैं. So let's do this movement. How to do this movement? Take the towel and we'll squeeze the towel between the thighs. हम towel को लेकर अपनी thigh के बीच में दबाएंगे. Okay. So lie down the supine, or we also can do in the standing. First do in the supine. So we are keeping the towel in between the thighs like this. Now we have to press the towel with our full force 10 times and hold for a while. Like one, I'm squeezing the towel like you are squeezing the lemon and you want to take out the juice from the lemon. In the same way, squeeze the towel from the thighs. Start. 1, 2, 3. You can feel the muscle of the inner thigh. 4, 5. They are the adductor muscle. 6, 7, 8, 9, 10. Now take the towel, keep between the knees and do it again. Start. 1. Now we are pressing both the knee together. 2, 3. Do not rotate your leg. Your leg should be straight. 4, 5, 6, 7, 8, 9, and 10. Relax. Now we can also do with the help of towel. So suppose when we are using adductor muscle, even I will tell you, we have to take the leg to the other side and then we have to pull the leg to one side, or we can fix the leg somewhere, maybe on some wall, and then so someone is pushing our leg to the other side, someone is opposing our movement. I want to bring my leg to the inner side, but if someone pushing my leg to the opposite side, then I will use these muscles. Okay, so suppose I am bringing my leg in this way, you will not feel that much, but someone will be pushing it in the opposite direction, then I will apply the more force here and I will feel that I'm using my adductor muscle. Okay, so I create little force to the opposite side, but definitely if someone else will create the force, that will be greater. Okay, now I want to bring my leg to the inner side. Now I can feel the clear forces coming here and I am bringing to the center line. Okay, going back. In this way, right? So we are using this adductor muscle to bring our leg back to the central line. Okay, or this is called adduction. When we are adding both the leg together, this is called adduction. Okay, let's move to the next movement. अब हम अगले मूवमेंट की ओर आगे बढ़ रहे हैं. हमने 4 मूवमेंट समझ लिए. The next movement will be rotation. So first we'll be seeing the lateral rotation. So what is the meaning of lateral rotation? You can see here. You can see here when this hip is going laterally, like we can see it's going laterally. So it's going outward, laterally, rotating outward. That is called lateral rotation. जब भी हमारा हिप ऐसे घूम के बाहर की तरफ खींचता है, so we can see this muscle. This is the gluteus maximus muscle, who is responsible for the lateral rotation of the hip. जो हमारी हिप का lateral rotation करती है, this is the gluteus maximus. But other muscle are hidden inside the gluteus maximus, the piriformis, who also do lateral rotation. ये piriformis भी करती है. Then we can see here superior gemellus, inferior gemellus, obturator internus, obturator externus, and the rectus and the quadriceps femoris. I already discussed with you in the previous class. There are 7 muscles are mainly doing this movement. 7 muscle हैं जो ये movement करते हैं. If you remember, there are 7 muscles who do lateral rotation. Gluteus maximus is the outer covering. Then piriformis. Piriformis is the very important muscle. If you just want to remember 2 muscles, then remember gluteus maximus and the piriformis. Why this piriformis muscle? Because when the person suffering with the sciatica pain, this muscle is painful. This muscle is creating pain. जब व्यक्ति को साइटिका का पेन होता है तो कई बार ये मसल जिम्मेदार होती है. Other than that, we can see superior gemellus, inferior gemellus, is the rectus femoris, quadratus femoris, obturator externus and internus. We already have discussed earlier all this muscle. ये 7 muscle हैं जो ये movement करती हैं. You can see the movement once again. How these muscle pulling the hip laterally. The most important muscle is the piriformis muscle, because when the piriformis muscle is having some problem, the person is suffering with the sciatica pain. उस व्यक्ति को sciatica का पेन होने लगता है अगर piriformis muscle में कुछ प्रॉब्लम है तो. So we can see these muscles here. Okay, it's the 7 muscle. So let's do this movement and remember the at least 2 muscle from the lateral rotation, gluteus and piriformis. And for seeing the detailed description, go on the video where we have discussed all the 7 muscles.
ನೋಡು ಕಾಲಮ್ಮ ನಾವು ಪತ್ತು ಕರೆಕ್ಟ್ ಆಯ್ತಂದೆ.
So let's see now and doing the lateral rotation. So begin, take the support of towel. Let's holding the feet up and now rotating to the lateral side. You can see I'm rotating my hip to the lateral side. So this is the lateral rotation. Bring it back. Again, go to the lateral side. You can go as much as possible. Do it 10 times. One, coming back. Two, three, four, five, six, seven. When I'm doing this movement, I am using lateral rotator, gluteus maximus, piriformis, superior gemellus, inferior gemellus, obturator externus, obturator internus, and quadratus femoris. I'm using my 7 lateral rotator muscle. Relax. So we'll be doing from the other leg now. The same movement हम अब दूसरे पैर से करेंगे. The lateral rotation of the hip. Holding the leg. Start now. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So in this way, we have done the lateral rotation of the hip. Relax for a few seconds. So again, this is the flexion. Do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is the flexion. Bring from the other leg. Start. 1, 2, 3, 4, 5, 6, 7, 8, 9, and this is the flexion. Now turning on the prone and do the extension. Start from the right leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do by the other leg. Extension of the hip. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, lie on the side. Now, abduction. Abduction, do like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do with the other leg, abduction. Do 10 rounds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Lie down on the supine. We can do abduction in this position also, like this. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do with the other leg. Same abduction, right? Like this. Abduction. We have to take the leg to the other side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So remember one thing. When we are doing abduction, we are taking the entire leg laterally. So, but in the rotation, we are taking doing rotation like this, right? So I am doing like this. So you can see the position of the leg, it is rotating like this. So we can see the lateral rotation means like this. This is the lateral rotation, going outward. Okay, that is the lateral rotation. So let's do the lateral rotation in the standing position. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Doing from the other leg. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So this is the lateral rotation, okay? We can see it. So when we are doing this movement, our legs are laterally rotated. Got it? Do this. Come in this position. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. So now the final movement we'll do the internal rotation of the hip now. The internal rotation means when we are rotating to the inner side. Medial rotation or the internal rotation. So we can see here. So medial rotation. So when we are bringing the hip to the medial side, inner side, we can see how the hip is moving to the inner side. Who is moving the hip to the inner side? Who is pushing the hip to the inner side? Who is contracting and hip is moving to the inner side? So this is called medial rotation. Medial rotation कौन कराता है? So we can see here the few group of muscle. Tensor fascia lata is moving the hip to the inner side. Gluteus medius. So tensor fascia lata and gluteus medius and gluteus minimus. ये तीन muscle. The same muscle was doing one more movement earlier. Now I will do the comparison with all the movements. So again, you see, if you remember the hip abduction, this is the hip abduction. The hip abduction is done by the same muscle, tensor fascia lata, gluteus medius and minimus. So hip abduction यानी पैरों को दूर ले जाने वाली जो मसल है, the same muscle are doing internal rotation. We can see the same muscle are doing the medial rotation. The three muscles, gluteus medius, tensor fascia lata and minimus. So you have to remember this. Little effort, then you will memorize. Thoda sa. So let's do the internal rotation. And you can feel the effect also. So first lie down and do this movement. We have done lots of movement, hip abduction. So this is the hip abduction, right? Start now. One. So these muscles, gluteus medius, minimus and tensor fascia lata, who is doing hip abduction, the same muscle will be doing medial rotation. Okay, now I will be doing medial rotation. So bringing my leg inner side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, let's do once again. Hip abduction 10 times. 1, 2, 3, 4, gluteus medius, gluteus minimus, TFL or tensor fascia lata, gluteus medius, gluteus minimus, TFL. Okay, now lift the leg little up till the 30-degree and do the internal rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Now doing from the other side. First we'll do hip abduction. Start now. 1, gluteus medius, minimus, lata, gluteus minimus, medius, tensor fascia lata, hip abduction. Now lifting the 30-degree, now doing the internal rotation. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax in the supine. Just lose your entire body, top to bottom. Do the 5-minute savasana or deep relaxation. Bring your awareness to your toes. Relax your toes. Relax your entire feet. Relax your ankle joint. Bring your awareness to your calf muscle and relax them. Relax your knee area. Relax your thigh. The both legs are completely relaxed. Now bring your awareness to the abdomen. Abdominal muscles are relaxed, chest are relaxed, back, upper back, middle back, lower back relaxed. Feel the relaxation. Both arms are completely relaxed, shoulder to finger. Your neck are relaxed. Relax your head, soften your eyes and lips. Close your lips and eyes softly. Relax your entire body top to bottom. Just be in this position for a few minutes. Then we'll conclude the session.